Susan Weiner for DLife.com. If you have diabetes, you often hear about the importance of good blood glucose control. What is good control? Target numbers can vary from person to person and should be discussed with your doctor, but there are some general guidelines. According to the American Association of Clinical Endocrinologists, before a meal, the goal is to stay under 110. 2 hours after the start of a meal, your reading should stay under 140. And your A1C, which is a test that shows your average blood glucose over the past 3 months, should be 6.5 or lower. The American Diabetes Association has slightly different guidelines. The better your blood glucose control, the lower your risk of long-term diabetes complications. Also, keeping your blood sugar in your target range will keep you feeling your best. The first step in getting control of your diabetes is making some healthy lifestyle changes. These include eating right by controlling your carbohydrate, calorie, and saturated fat intake. And it also means exercising. It also means losing weight if you have excess body fat. It's the prescription for better health for everyone. But for people with diabetes, these lifestyle improvements can make an enormous difference in how well you control your blood sugar. When lifestyle changes aren't enough to bring blood glucose levels down to a patient's target range, most doctors will prescribe medication. There are many options in oral diabetes drugs today. 7 different classes of drugs lower blood glucose, and each one works in a different way. Some help the body make more insulin, which is the hormone that allows glucose to get inside our cells and give them energy. Some lower blood sugar by decreasing the amount of glucose produced by the liver, and by making the body more sensitive to insulin, or helping insulin work better. Another type interferes with the digestion of certain carbohydrates, slowing the rise in blood sugar after eating. There are also some relatively new injectable drugs that have unique mechanisms of action. Sometimes a doctor will prescribe 2 or more drugs in combination that will give you your best control. If you experience any side effects, it's important to talk to your doctor. Often, side effects lessen over time. If they do become an issue, your doctor may be able to adjust your dosage to reduce side effects or may suggest another medication. Never alter your dosage or stop taking your prescription without speaking to your doctor first. Similarly, if your regimen isn't working for you, talk to your doctor about other options for achieving better control. Over time, the pills may stop working. Type 2 diabetes is a progressive disease, and in most cases, it becomes necessary to add insulin to oral medications or switch to insulin alone. Although your doctor is most likely to prescribe pills before insulin, some people do start on insulin right away, or a combination of insulin and oral medications. If you're pregnant or plan on becoming pregnant, talk to your doctor about the treatment that's right for you. Often people have psychological barriers to using insulin, either because they don't like the idea of injections or because it makes it seem like they have failed their treatment. It's important to see past these issues because for many people, insulin brings excellent control. Insulin can be injected. It can also be inhaled through the mouth at meal times. With all the options out there, it is very important that you communicate with your doctor and the other members of your healthcare team. Get your support system involved and reach out to other diabetes resources in your community and online, such as DLife. If you are fully informed, you can help your healthcare team make the best medication decisions for your optimal health.